Right at the start of the pandemic, we were asked to put together a team at pretty short notice.
The problem that they were facing at the time was that around 30 to 40% of some NHS organisations were in isolation with unconfirmed coronavirus symptoms. By us delivering a home testing service whereby they could find out whether or not they had coronavirus, or if a household member had coronavirus, they could then return to work a lot sooner. So when we started, the brief that we got was to build this service in 7 days.
The unusual thing about this project was that we never got a chance to meet in face. Normally you have a kick-off meeting where you meet face-to-face with your team members, but this was done entirely remotely.
When we were looking at how do we do whiteboarding and all these other tasks, let's give Miro a shot.
The first thing we did was to write our goal in big letters in the middle of our Miro board. And then we tried to understand the users and the steps they might take and put sticky notes all over the board.
Then started to evolve into process maps, which then started to evolve into much more complex versions of the service or different variables of a potential user journey.
Miro in the early stages was a key source about the project. So it was important we both create and consume information about the project really quickly. And being a visual tool, it made it easy to digest information rapidly. Well, to date, we've shipped around about 1 million test kits, and I'm very proud of the service we've built.
The service has been incredibly successful, I think, in achieving this outcome and making a positive impact. Incredibly proud of what we've achieved, and I'm looking forward to what happens next.